High blood pressure, also known as hypertension, is a condition that affects nearly half of all adults worldwide. It's often called the silent killer because, despite its lack of obvious symptoms, it quietly increases the risk of serious health issues like heart attacks, strokes, kidney disease, and even vision loss. According to the World Health Organization, over 1.2 billion people are affected by hypertension, and millions remain undiagnosed. But what exactly causes high blood pressure, and more importantly, how can it be brought under control? Let's take a closer, data-driven look, taking care to separate fact from myth and generalizations. To understand high blood pressure, it helps to start with the basics. Blood pressure is the force that circulating blood exerts on the walls of your arteries. It's measured in millimeters of mercury and given as two numbers, systolic and diastolic. Systolic pressure, the higher number, represents the force during heartbeats, while diastolic pressure, the lower, measures force between beats. A reading below 120/80 is considered healthy. Hypertension is defined as a sustained blood pressure of 140/90 or higher, according to guidelines from organizations like the American Heart Association and the European Society of Cardiology. One might wonder, how does blood pressure get too high in the first place? The answer is rarely one single cause. Instead, hypertension develops due to a combination of genetic, environmental, and lifestyle factors. Let's break these down using data and scientific understanding. Family history and genetics play a significant role. If one or both parents had high blood pressure, the risk in their children rises significantly. The heritability of hypertension is estimated at 30 to 50%. Specific genes have been associated with how the body handles sodium and regulates vascular tone. However, genes interact with environment. Just because hypertension runs in a family does not ensure it will occur, but it does set the stage. Next, age is a well-established factor. The prevalence of hypertension increases steadily with age. According to the U.S. Centers for Disease Control and Prevention, about 22% of adults aged 18 to 39 have high blood pressure. But that number jumps to nearly 55% for those over the age of 60. Why? Our blood vessels gradually lose their elasticity as we age. Arteries stiffen, and this makes it harder for blood to flow smoothly. A major environmental contributor is our diet, especially sodium intake. According to the National Health and Nutrition Examination Survey, average sodium consumption in many countries exceeds the recommended daily maximum of 2,300 milligrams by 30 to 50%. Excess dietary sodium causes water retention, increasing blood volume and the pressure on vessel walls. Large-scale studies, such as the InterSalt study, have found direct correlations between populations with high average sodium intake and the prevalence of hypertension. But sodium isn't acting alone. Diets lacking in potassium, fruits, vegetables, and whole grains are also risk factors. Potassium found in bananas, potatoes, and leafy greens helps balance sodium's effects and allows blood vessels to relax. People whose diets are consistently low in potassium are more likely to develop hypertension. Weight and physical activity are also inextricably linked. According to recent global data, about 40% of adults are overweight or obese. Excess body weight increases the demand on the heart, compresses blood vessels, and sets off inflammatory processes throughout the body. For every 10 kilograms, or about 22 pounds, of excess weight, systolic blood pressure can rise by 2 to 3 points. Physical inactivity compounds this effect. Sedentary lifestyles contribute to weight gain and reduced cardiovascular efficiency, both of which elevate blood pressure risk. Alcohol and tobacco are two well-proven modifiable contributors as well. Regularly consuming alcohol in more than moderate quantities, defined as more than 1 drink per day for women, 2 for men, raises blood pressure even in so-called social drinkers. Tobacco use, whether by smoking or chewing, damages blood vessel walls and accelerates the process of atherosclerosis, the buildup of fatty deposits in arteries. Within minutes of smoking a cigarette, blood pressure can spike, and chronic exposure compounds the risk. Stress is often mentioned when talking about blood pressure, and the science supports this connection, though not always in the way portrayed in popular culture. Acute stress does cause blood pressure spikes. Chronic, poorly managed stress is associated with sustained hypertension, likely by altering hormones such as cortisol and leading people to unhealthy behaviors like overeating or excessive drinking. Medical conditions can also be underlying causes. Kidney disease, thyroid disorders, and certain hormone problems can drive high blood pressure. Sometimes these are termed secondary hypertension, meaning high blood pressure as a result of another medical issue. However, in about 90 to 95% of cases, the specific cause isn't clear-cut. This is known as primary hypertension, the most common kind. Given all these causes, the big question is, how can people take concrete steps to reduce and control high blood pressure, relying on robust scientific evidence rather than vague advice? The reassuring news is that even for people with a strong family history or advancing age, lifestyle changes have enormous power to lower blood pressure and reduce health risks. One of the most effective interventions is dietary improvement. The dietary approaches to stop hypertension, DASH diet, studied extensively since the 1990s, emphasizes fruits, vegetables, low-fat dairy, whole grains, lean protein, and reduced sodium. In clinical trials, patients following the DASH diet experienced reductions of systolic blood pressure by 8 to 14 points, often within a matter of weeks. Even for those already on blood pressure medications, incorporating DASH principles provides additional benefit. For most adults, lowering daily sodium intake to below 2,000 milligrams can reduce blood pressure by about 5 to 6 points. This often means being mindful of processed and packaged foods, as more than 70% of the sodium in Western diets comes from these sources, not from the salt shaker. Reading nutrition labels and opting for lower sodium versions can make a measurable difference. At the same time, increasing potassium intake, aiming for 3,500 to 5,000 milligrams per day, helps keep the sodium-potassium balance in check. Foods like beans, oranges, potatoes, and spinach are solid choices. Regular exercise is another well-established method. According to the American College of Cardiology, just 150 minutes per week of moderate-intensity aerobic activity, such as brisk walking, cycling, or swimming, can lower systolic blood pressure by 4 to 9 points. Strength training adds further benefit by supporting weight loss and vascular health. Weight management is crucial. Data across multiple clinical studies show that losing as little as 5 to 10% of body weight can lower blood pressure substantially, sometimes enough to eliminate the need for medication. For instance, in the Framingham Heart Study, participants who lost excess weight saw their risk of developing hypertension fall by nearly half. Limiting alcohol consumption delivers tangible results. Reducing intake to within recommended limits can lower systolic pressure by 2 to 4 points for many people. Quitting smoking, while having a smaller direct effect on blood pressure, significantly reduces the risk of heart attacks and strokes and allows arteries to recover over time. Stress management strategies, such as mindfulness meditation, deep breathing, regular physical activity, and adequate sleep, have gained increasing support in scientific studies. The American Heart Association notes that individuals who integrate stress reduction techniques into their lives see reduced daytime blood pressure readings and better long-term cardiovascular outcomes. Medications are sometimes necessary, especially when blood pressure remains high despite lifestyle changes or when readings are dangerously elevated. Modern antihypertensive drugs, such as ACE inhibitors, beta blockers, calcium channel blockers, and diuretics, have strong evidence supporting their effectiveness and safety. The decision to begin medication is made in consultation with a healthcare provider based on a person's overall risk and health profile. Regular monitoring, both at home and with a healthcare provider, is central to understanding and controlling blood pressure. Home blood pressure monitors are now accurate, easy to use, and affordable. The ability to track readings over time helps patients and their providers make informed decisions and recognize patterns. It's important to approach the management of high blood pressure holistically, not as a single fix, but as an integrated set of changes in diet, physical activity, stress, and when appropriate, medication. The combination of small improvements in each area creates what's known as the cascade effect, when each positive change amplifies the benefit of the others. But what about those who believe they feel fine and are therefore not at risk? It's vital to remember that hypertension typically produces no warning signs. The first symptom is often a heart attack or stroke. In a comprehensive 2022 survey, more than 40% of people diagnosed with high blood pressure reported they were completely unaware of their condition before a routine checkup. Screening and regular monitoring are crucial. Adults should check their blood pressure at least once every 2 years, starting at age 18, more often if risk factors exist or readings trend high. Earlier detection leads to earlier intervention, and the cumulative benefit of years with controlled blood pressure far outweighs the alternative. The impact of controlling high blood pressure is far-reaching. A meta-analysis published in The Lancet found that lowering systolic blood pressure by 10 points reduces the risk of major cardiovascular events, such as heart attack and stroke, by 20%. Even modest reductions in blood pressure, sustained over years, translate to thousands of heart attacks and strokes prevented, improved quality of life, and decreased healthcare costs on a population level. Public health initiatives have shown that community-wide changes can make a difference. In Finland, for example, a sustained campaign to reduce sodium in processed foods, combined with health education, led to a 75% decrease in population sodium intake over several decades, with corresponding drops in average blood pressure and heart disease mortality. But ultimately, managing blood pressure comes down to individual choices, supported by evidence, empowered by awareness, and guided by regular engagement with healthcare professionals. Understanding that blood pressure is not a fixed trait, but a dynamic number influenced by daily habits and lifelong factors, is essential. To summarize, high blood pressure is a complex and common health issue shaped by lifestyle, environment, genetics, and existing medical conditions. Its dangers are serious but preventable. Concrete, evidence-based actions, like adopting a lower sodium, potassium-rich diet, maintaining a healthy weight, engaging in regular physical activity, moderating alcohol, avoiding tobacco, and managing stress, offer real, measurable benefits. For those who need it, safe and effective medications provide an additional layer of protection. And the cornerstone of all effective strategies is awareness, knowing your numbers, understanding your risks, and taking proactive steps to safeguard your health. By replacing vague warnings with concrete data and actionable steps, everyone can reduce risk, prevent complications, and lead a longer, healthier life with blood pressure under control.